Lacerations are a tear or a split of skin, mucous membrane, muscle or internal organs produced by the application of the blunt force to the body, which stretches the tissues beyond their limit of elasticity. Also called a rupture, displacement of tissues is more common when the soft tissues are crushed against bone, scalp, facial bones, shoulders and shoulder. General characteristic: margins irregular, ragged, uneven. Edges angular, impact. Skin on the side of the wound opposite to the direction of the motion is usually torn and free and undermined. Skin on either side, the side from which blows was delivered, is abraded and beveled. Perpendicular impact, usually undermining on all sides. Depth depends upon the degree of force, depth of soft parts of at the site of the injury. Sharp and shape and size may not correspond with the weapon which produced it. Linear, produced by long, thin object, crowbar, pipe. Irregular, ragged or Y-shaped, produced by object with a flat surface if curved. Convexity of curvature point towards the direction of the application of force. Stellate, star-shaped, produced by blunt round object. Crescentic, produced by a blunt round object with edge, hammerhead. Semicircular, striking head against wall or other head surface due to convexity of head. Pattern laceration, swallow-tail or at one end, seen sometimes due to tearing at angles of laceration. Shape and size often give information regarding offending the weapon. Case studies: an under prisoners was brought to the water with a semicircular laceration on forehead at the hairline with the allegation that he has been hit by a police baton. Police baton is longitudinal and cannot produce semicircular laceration. Nail laceration, tear at one angle, giving rise to shallow tail appearance. It was opined that he might have hit his head against some hard surface, example walls. A visit to his cell revealed bloodstain on the wall, roughly at the height of his forehead, a gapping present due to pull of elastic and muscular tissues, bruising in skin or subcutaneous tissue around the wound. If the force is exerted by the object moving in a downward direction, the lower margin of the wound may show bruising and undermining. Tissue bridges. The tissue bridges or bridging fibers are seen at the base of the wound. This is become deeper tissues, blood vessels, connective tissue, elastic fibers, nerves are unevenly divided. The tissue bridges become apparent when the edges of the wound are generally separated manually. Medico-legal importance. Their presence immediately indicates blunt force trauma. Internal organs bridging is also seen in internal organs as in liver, kidneys, pancreas and spleen. Hair bulb crushed. Hair and epidermal tracts are deeply driven into the wound. Hemorrhages less in lacerations because vessels are crushed and torn across irregularly. They can retract, blood clot easily. Exception: scalpel laceration where hemorrhages is more. Temporal artery is firmly bound, unable to retract. Foreign matter usually present in the wound. Difference between sharp and blunt force: no contusion around sharp force injury. Former has sharp margins, later irregular margin. In former, vessels are clean cut and no tissue bridges. Later, vessels are crushed, there are tissue bridges. No contusion around this difference between sharp and blunt force trauma. No contusion around the sharp force injury. Contusion around blunt force: former have sharp margins, later have irregular margins. In a former, vessels can be clean cut, no tissue bridges. In later, vessels are crushed and there are tissue bridges. Sharp force and blunt force. Types. The most general type of laceration is the tear. Encountered most commonly occurs when the blunt force is applied to the skin, having sufficient amount of underlying fat and muscles. Thigh. caused by a heavy blunt weapon, a cricket bat, a hockey stick, a lathi has ragged and bruised margins. Split laceration occurs when the blunt force is applied to the skin directly overlaying a bone with a minimal amount of underlying fat and muscles. Scalp, zygomatic process, chin, tip of shoulder, back of elbow, anterior superior spine, shin. Mechanism: skin is a split between the weapon and underlying bone. Appearance mimics an incised wound. Incised booking lacerated wound. Examination of the with a hand lens is helpful. Incised wound and incised looking lacerated wound. Margins where the seen underlay hand lens is clean cut in incised wound. But incised looking lacerated wound, ragged and bruised. Edges heavily bruised in an incised looking lacerated wound, but there is no or minimal bruising. Blood vessels at the base of the wound. Blood vessels are at the base are clean cut. Blood vessels at the base are crushed in incised looking lacerated wound. Other tissues at the base of the wound, tissues such as a facial band, nerve are clean cut. Facial bands and nerve are either crushed or seen intact. They show continuity. Hair around the wound clean cut. Incised looking lacerated wound crushed. Difference between true incised and lacerated wound. True incised edges clean cut. True lacerated wound ragged. Margins not bruised in true lacerated wound. Injury to the blood vessels, nerves, tendons, fascia at the base of the wound is clean cut in true incised wound, but crushed in a true lacerated wound. Hair bulb clean cut, crushed in true lacerated wound. Bleeding more in a true incised wound, less in a true lacerated wound. Stretch laceration is caused if the force is applied in such a manner that the skin is overstretched, resulting in a large flap. Glancing kick by foot. Cut laceration is produced by a heavy cutting weapon. Axe, boat, propeller, bush, knife, chopper, hatchet, industrial and farm machinery. Blade machete, a large heavy knife used for cutting sugarcane. Meat cleaver, wielded with a tremendous amount of force. It may best be conceived as a cross between a true laceration and a true incision. Edges of the weapon do cut the skin, but since edges are heavy and they crush and bruise the margins of the wound too. The wound shows an ugly wide gap. The underlying bones are frequently fractured or deep grooves cuts. These are called chop wound. Avulsion is produced if a grinding compulsion, fast moving tire of a heavy motor vehicle, run over injury or rotating heavy industrial machine is applied, causing avulsion or separation of a large area of skin from its underlying attachment is lost. Wound is devoid of any overlying skin and also known as a flaying. Underlying muscles are heavily bruised. Summarize various types of laceration, how they are typically exposed. Types of laceration. This avulsion skin tears. Tear laceration. Any heavy blunt weapon, hockey stick or cricket bat. Split laceration. Any heavy blunt weapon on an area of body which has some bone directly underneath with a scanty layer of intervening tissue scalp. Stretch laceration, a heavy force acting on the body in such a manner that a portion of the skin is overstretched. Heavy cut laceration, heavy cutting weapon with an edge which may not be too sharp. Avulsion, heavy weight, a truck passing over the body causing large area of skin to be avulsed and lost, also called flaying. Ages of laceration. Age of determination is difficult unless clear signs of healing are present. Fibroblast, granulation tissue and organic infiltrate. Antemortem and postmortem laceration. Antemortem laceration may show bleeding, blood staining of margins, bruising and aversion, gapping and vital reactions. Postmortem laceration would have none of this. Complication. Crushing of the tissue. Too much crushing may cause pulmonary or systemic fat embolism. Infections. Internal organs. Lacerations may cause severe bleeding, may be fatal. or amount of fetal bleeding. Laceration over wrinkled skin or joint, continued and repetitive using of tissue fluid and blood, irritation, pain, dysfunction. Multiple superficial laceration may cause death. Cumulative little bleeding from each superficial laceration may be sufficient to cause death. Medico-legal importance. Fight. Age of laceration. Fight indicates time of struggle, disputed paternity, pregnancy. Age of perineal laceration indicates the possible date of delivery. Combination of laceration with abrasion and bruises. Abrasion, bruises and laceration may be seen together. Each injury may be produced by different blow by the same weapon. They may be produced at the same time, as in explosion, punching with a fist, kicking, stomping with a shoe-wearing foot can produce all three injuries with the different blows. Extraneous material may be present in laceration. Dirt, dust, grass, grease and stone particles. This may connect the injury with the place of occurrence. Firearm lacerations produced by a pistol, piping, buffaloing. It is the act of holding a handgun by its barrel and clubbing the victim with the butt, in effect causing it a blunt weapon. Location predominantly on forehead. Manner of production, accidental falls, etc. Suicidal laceration are very rare because a person literally never uses a blunt force for suicide. Very painful and rarely effective. May be seen in suicidal generally from higher buildings. Homicidal laceration on the buttocks generally indicate a homicidal. Back, neck. Tiger claws is a claw-like shape, weapon inspired by an armature of big gap. If it fits over the knuckles or it's concealed under against the palm, it consists of 4 or 5 curved blades affixed to a crossbar or glove is designed to lacerate the skin and muscles. Some incorporate a spike or blade on one hand of the crossbar. This form is known as a Bikava bag knack because the blade is based on that of a Bikava scorpion knife. Bag knack was first described in India. A Maratha Emperor Shivaji used it to kill the Bijapur general Afzal Khan. The girls sometimes wear it to defend themselves when going out at night. Shape of laceration can very rarely indicate the nature of the offending weapon. Pattern laceration causes change. Pistol whipping, tendons and muscle laceration without corresponding laceration on skin can indicate the violent muscular contracture and spasm, convulsion like a stretching, convulsive natural disorders like epilepsy, tetanus. In such cases, laceration in the hollow viscera may be seen. Thank you.